Hi, and welcome to the final in this four-part webinar series in a collaborated partnership between the National Consumer Voice for Quality Long-Term Care and the National Long-Term Care Ombudsman Resource Center. My name is Dr. Sherry Gibson, licensed psychologist, and I'm pleased to present to you today on the topic of managing anxiety and grief in the time of COVID-19 in service of family members. The coronavirus has affected us in so many ways, physically and socially, economically, psychologically. All of us are dealing with the very real challenges of widespread serious illness and the inabilities of our healthcare systems to cope with it. Our social and community disruptions, economic fallout, and financial problems, all obstacles and interruptions in our daily aspects of life. And the list just seems to go on and on. The pandemic has also resulted in enormous loss of life, not only in our country, but across the globe. The collateral damage that this level of mortality would exact on American families cannot be overlooked. And it's important that the burden of bereavement and its potential mental health and physical health consequences are factored into discussions of the public health challenge facing all nations. Since the COVID-19 outbreak, science has documented that for some people, as a result of social inequities in how their identities are perceived and treated by society, are more impacted by others. COVID-19 has certainly exposed this nation's longstanding social and political inequities in race, class, gender, national origin, and other factors. And in recent months, we've witnessed an incredible display of hurt and righteous anger by marginalized Black and Brown people and entire communities. Across this country, people who cannot sit back in the wake of the death of George Floyd and many others before him. So what does this mean against a backdrop of a global pandemic where just in these past 6 months, most of our country has been quarantined? Although there's been substantial attention given to identifying persons with the coronavirus infection, identifying the mental health care needs of people impacted by this pandemic have been largely relatively neglected. This is surprising given the mass tragedies, particularly ones that involve infectious diseases that often trigger waves of heightened anxiety and fear that are known to cause massive disruptions to the behavior and psychological well-being of many of our population. For example, in a recent large survey of people highly susceptible to coronavirus infection, Chinese medical workers to be exact, the prevalence rate of traumatic stress was at an alarming 73.4%, depression at 50.7%, generalized anxiety at 44.7%, and insomnia at 36.1%. Although these findings are disturbing in and of themselves, they are not isolated, as research on the psychological impact of previous global disease outbreaks have demonstrated clear links between pandemic-related anxiety and elevated symptoms of stress, anxiety, contamination concerns, health anxiety, post-traumatic stress, and suicidality. There's been some interesting work coming out of the American Psychological Association where they've surveyed persons around the psychological effects of this global pandemic. And what they have found is that persons have endorsed large amounts of stress and an increase in stress around the economy and work. You can see here on this graph that when compared to a year ago, August 2019, those numbers were relatively low for stress around the economy, and in May had risen over almost 70%. For work as well, in August of 2019, that rate was 64%, and also had risen to 70%. It's important to note that on the work factor, those survey results were taken from people who were employed. So you can imagine what kind of stress would be documented for those who were unemployed secondary to this pandemic. Also parenting. Folks who are parents are under an enormous amount of stress, and in the same survey reported the highest amount of stress being impacted by concerns that a family member either had coronavirus or was susceptible to it, the government response to coronavirus, disrupted routines or adjusting to new routines, certainly managing online and distance learning of their children and having to adjust to what a homeschool environment would look like. Basic needs, the availability of and access to food and housing, also a big concern for parents, including self-isolation and access to health care or missing out on major life milestones. Additionally, nearly 7 in 10 Americans, that's 67% of those surveyed, say that the government response to the coronavirus was a significant source of stress in their lives. So the context of dying during this pandemic has a really remarkable impact on many people, many of us, whether or not we have experienced a death directly in our own lives, or just simply the amount of information that we're seeing on the media. The earlier images of the refrigerator trucks lined outside of hospitals and nursing homes, long-term care communities. And a lot of this is due in part to this shocking and unanticipated death. The isolation of family from the dying and from supports, people dying alone in this pandemic. There's a high level of anxiety and sense of helplessness that comes from fragmented caregiving and the fragmentation of important attachment bonds between people. There's also an existential crisis that happens where people are questioning their faith, questioning the presence of God amidst such suffering. And of course, this is against the backdrop of religious communities not being able to commune together or participate in important rituals in religious communities. A profound loss of meaning and the disproportionate loss among minority communities. Not to mention the overwhelmed medical system that where family supporters are a vital piece of caregiving and informing physicians and care teams about what is best for their family members when family members who are ill or who are dying cannot express their wishes. The medical system is really suffering from the loss of those important key members and families who can inform care. So what is normal grief? Well, grief reactions vary depending on who we are, who we lost, our relationship with that person who has died, and the circumstances around their passing, how much their loss affects our day-to-day functioning. Different people may express grief differently. You may even have a different grief response between one loss and another loss. Reactions to grief and loss include not just the emotional symptoms, but also behavioral and physical symptoms. And these reactions often change over time. It's important to note that all reactions are normal for a short period. So I've listed here some symptoms that are experienced. And on the emotional side, we see shock for the person, denial, numbness, sadness, anxiety, guilt, fear, anger, irritability. Behaviorally, it's not uncommon for people to experience bouts of unexpected crying, changes in sleep patterns, changes in appetite, withdrawing from others, restlessness, or trouble making decisions. And physically, problems with concentration, exhaustion or fatigue, decreased energy, problems with memory, and also stomach problems, upset stomach, pain, headaches. Prolonged grief is also a diagnosis. And the ICD-10 lists out some criteria about what prolonged grief is. Well, first and foremost, it involves the death of a close person. And it is the persistent and pervasive grief response that's accompanied by a longing for or a preoccupation with the deceased. Involved in that is intense emotional pain. All of those behavioral and emotional symptoms that I listed earlier, with a minimum of a 6-month period after the person's death. And that exceeds all social, cultural, and religious norms. There's significant impairment, and this is probably one of the most important things, in a personal, familial, social, occupation, and other realms of functioning. Death during this time of a global pandemic has meant that we have to grieve in isolation, which is somewhat of an oxymoron, particularly in our culture, where mourning is experienced as a shared and social practice. The spike in the COVID-19 related prolonged and complicated grief that will be a result of this pandemic is a potential public health crisis. There's a sense of urgency right now in the need to provide timely mental health services and for people to have access to mental health services. And on the other side of that, this can be an opportunity for all of us, entire communities, to think creatively about our bereavement efforts. We have learned from prior epidemics, such as the Ebola in Congo, about ways that we can mourn and grieve in community in order, though, to still keep people safe and protected from spreading infection. In this time that we find ourselves, we have seen that funerals are now being live streamed, and physicians and chaplains are using technology such as speaker and video chat functions to allow families to say goodbye to a critically ill loved one and to deliver last rites. We're considering this new era termed as e-mourning. So where do we go? How do we cope with our grief? And the grief may not just be around a person dying, but it's also grief around loss of what we knew as normal. The pandemic is now becoming chronic in our approaches to all kinds of things. Being in our community, going to the store, schooling, parenting, accessing or engaging in healthcare. Our work has changed. You'll see even in this video that I'm sitting in my office, and this is how we're living now. It has changed everything, but we have to find ways in order to cope. And so I'm going to share with you some tools that might be helpful in your daily life. Dr. Russ Harris, a psychologist who is also the author of The Happiness Trap, has shared with our community a really important acronym that I've been using not only in training professionals or sharing with families or residents, but also in my private practice. And this acronym is titled Face COVID. I'm going to go through each of these, but just briefly. FACE stands for focusing on what's in your control, acknowledging your thoughts and feelings, coming back into your body, engaging in what you're doing. COVID is committed action, opening up, values, identifying resources, disinfecting and distancing. So let's dive in. It's all too easy to get lost in the worry and the rumination about all sorts of things that are out of your control. What might happen in the future, how the virus might affect you or your loved ones or your community, your country, your world, and what will happen then, and so on and so on. While it's completely natural for us to get lost in such worries, it's also not very useful or helpful. The reality is that we all have far more control over our behavior than we do over our thoughts and feelings. So our number one aim here is to take control of our behavior right here and now to respond effectively in a crisis. This involves both dealing with our inner world, that is all of our difficult feelings and thoughts, and our outer world, which are all the real problems that we are facing. But how do we do this? Well, let me provide you with kind of a metaphor, if you will. When a big storm blows up, the boats in the harbor drop anchor, because if they don't, they'll be swept out to sea. And of course, dropping anchor doesn't make the storm go away because anchors don't control weather, but it can hold a boat steady in the harbor until that storm passes in its own good time. Similarly, when we are found ourselves in an ongoing crisis, we're all going to experience those emotional storms, unhelpful thoughts spinning around in our heads and painful feelings whirling around our bodies. If we're swept up in that storm inside of us, there's nothing effective that we can do. So the first practical step is to drop anchor. We're going to apply what Dr. Harris calls the ACE formula. So silently and kindly, you want to acknowledge whatever is showing up inside of you, those thoughts and feelings, emotions, memories, sensations, urges. Take the stance of a curious scientist, observing what's going on in your inner world. As you do this, often it's helpful to put into words and silently say something to yourself like, I'm noticing anxiety, or here's grief, or there's my mind worrying, or I'm having a feeling of sadness, or I'm having thoughts about getting sick. And while continuing to acknowledge your thoughts and your feelings, you want to come back into your body. Now note, by coming back into your body, that does not mean that you're turning away from, escaping, avoiding, distracting yourself from what's happening in your inner world. The aim here is to remain aware of your thoughts and feelings. Continue to acknowledge their presence and connect with your body and actively move it. Why is this so important? Well, it's important so that you can gain as much control as possible over your physical actions. Even though you can't control your feelings, remember, the F stands for focusing what's in your control. I've listed some ideas here about how you can come back into your body. It may be just straightening yourself up, rolling your shoulders, maybe pressing your fingertips together, slowly stretching your neck, your arms, and of course, breathing. Breathing in slowly and releasing. And doing this very methodically and intentionally can help bring yourself, ground yourself back into your body. While you're doing that, after you come back into your body, you want to get a sense of where you are and refocus your attention on the activity that you're doing. Find your own way of doing this or try some of these methods. So you can look around the room and just notice 5 things that you can see. Then notice 3 or 4 things that you can hear. and then maybe one or two things that you can touch tactily. You want to end the exercise by giving your full attention to the task or your activity at hand, throwing yourself into the moment. Dropping anchor is a very useful tool. The better you anchor yourself in the here and now, the more control you will have over your actions, which makes it easier to face the next part of the COVID acronym. Committed action. Committed action means effective action, guided by your own core values, action that you take because it's truly important to you, action you take even if it brings up difficult feelings and thoughts. Once you've dropped anchor using that ACE formula, you will have a lot more control over your actions. So this makes it easier to do the things that truly matter to you. Now, obviously, that also includes all those protective measures against COVID-19, frequent hand washing, social distancing, and so on. But in addition to those fundamentals of effective action, you also want to consider asking yourself a few other things. If you're spending a lot of time at home during quarantine, what is the most effective way that you can spend your time? You might want to repeatedly ask yourself through the course of a day, what can I do right now, no matter how small it may be, that improves the life for myself or others I live with, or people in my community? And whatever the answer is, do it and engage with it fully. You might want to say some kind words to somebody who's in distress, excuse me, in person or through a phone call or a text message or a card in the mail. Is there something that you can do to assist a person with a task or a chore, to cook a meal, hold someone's hand, or play a game with a young child? Can you comfort or soothe someone who is ill? Opening up means making room for difficult feelings and being kind to yourself. Difficult feelings are guaranteed to keep on showing up as this crisis continues to unfold. Fear, anxiety, sadness, guilt, loneliness, frustration, confusion, and many more other feelings. We can't stop them from arising within us. They're normal reactions. But we can open up and make room for those feelings, acknowledging that they're normal, allowing them to be there, even though those feelings hurt, and treat ourselves kindly. Remember, self-kindness is essential if you want to cope well with this crisis. Ask yourself this: if someone you loved was going through this experience, the experience that you're having, for example, feeling what you're feeling, if you wanted to be kind and caring towards them, how would you treat them? How would you behave towards that person? What might you say or do to comfort them? And then try treating yourself that same way. Committed action should be guided by our core values. Your values might include love, respect, humor, patience, courage, caring, openness. The list is almost infinite in terms of our values. Look for ways to sprinkle those values into your day. Let them guide and motivate your committed action. Things that you could ask yourself are, what do you want to stand for in the face of this crisis? What sort of person do you want to be as you go through this? How do you want to treat yourself and others? And this last one I really appreciate. What can you say and do that will enable you to look back in years to come and feel proud about your response? Identifying important resources to help assist, support during this process is really critical. Some important resources for you come through the National Consumer Voice and also NORC. An important aspect of this process for all of us is finding that reliable and trustworthy source of information for updates and guidelines to help guide our own understanding of the crisis and where we can be most effective. The World Health Organization is a great place, CMS, and as I've said, NORC and the National Consumer Voice are also wonderful resources for you. And we can't say enough about disinfecting and distancing ourselves physically in order to decrease the amount of contamination and finally put this infection back at bay. Physical distancing, it should be noted, does not mean that we cut ourselves off emotionally. Those actions of disinfecting and distancing ourselves are truly caring in nature. And it really harkens back to the golden rule. We want to treat others as we want to be treated. We want to love our neighbors so that they will love us. And sometimes that love has to involve distancing right now. But we don't have to cut ourselves off emotionally from one another. We just can't be close to one another, which I know is very, very hard for so many of us. So in summary, again, use this acronym, FACE COVID. You might even want to print this slide if you can and tack it up somewhere just as a daily reminder. When you start feeling that anxiety and that fear of the unknown creeping up inside of you, remember there are things that you can do for yourself, and you can use this as a guide for others in your life. Pass it on. I want to take a moment to talk about grief too. It is normal and important to express our grief and to work through the concerns that arise in us at this time. Avoiding those feelings may not be helpful and may delay or prolong our grief if we don't attend to it. So here are some suggestions that might be helpful to you or those that you love or are in your circles. You want to find supportive people to reach out during grief. This is the time when the support of others may be most helpful. Don't be afraid to tell them how they can best help, even if it means just listening. It's often helpful to talk about your loss with people who will allow you to express your emotions. You want to take care of your health. Often at a time of loss, we stop doing the things that we need to do for healthcare, such as exercising, eating correctly, and taking prescribed medications. If you're on a healthcare regimen, it's important to follow that plan, making adjustments in the context of limited access and physical distancing. You want to consider postponing any major life changes. Give yourself time to adjust to the loss before making plans to change a job, move or sell your home, remarry, and so forth. Grief can sometimes cloud your judgment and ability to make decisions. Consider keeping a journal. This is often very helpful. It's a great way to work through those feelings and write or tell a story about your loss and what that means to you. Participate in activities. Staying active through exercise, enjoyable activities, outings with supportive others, or starting new hobbies that can help get you through tough times while providing opportunities for constructive development and use of energy. Finding a way to memorialize ones who have died. That can be done in a myriad of ways, planting a tree or a garden in the name of a loved one, dedicating a piece of work to their memory, contributing to a charity in their name, or other activities can be very helpful. And then finally, you might want to consider joining a grief support group. Remember that depressive feelings such as sadness are a fundamental part of a normal. And it is normal and important to express your grief and to work through the concerns that arise for you at this time. Avoiding your feelings may not be helpful and may delay or prolong your grief. So I'm providing here some suggestions that may help you and others in your life. First, you want to maybe find some supportive people to reach out during your grief. This is the time when support of others could be most helpful. Don't be afraid to tell them how best they can help, even if it means just listening. It is often helpful to talk about your loss with people who will allow you to express the full range of your emotions. It's also important to take care of your health. Often at a time of loss, we stop doing the things we need for our health care, such as exercising, eating correctly, or taking prescribed medications. If you are on a healthcare regimen, it's also important to follow that plan, making adjustments in the context of limited access and physical distancing. Also, postpone, if you can, major life changes. Give yourself time to adjust to your loss before making any big plans, such as changing jobs, moving or selling your home, remarrying, and so forth. Grief can sometimes cloud our judgment and our ability to make sound decisions. Keeping a journal is also very helpful. It's a way to work through your feelings, to write or tell a story about your loss and what it means for you. And participating in activities, staying active through things that are meaningful to you. Maybe it's exercise, outings with supportive others, maybe even starting new hobbies that can help you get through tough times while providing opportunity for construction or constructive development and use of your energy. Find a way to memorialize your loved one, maybe planting a tree or a garden in the name of that person, dedicating a piece of work to their memory, or contributing to a charity in their name. Some of those activities can also be very helpful. And then finally, I'd like for you to consider joining a grief support group. Remember that depressive symptoms, such as feeling sad, are a fundamental part of a normal bereavement. Staying active and finding support from others can help you work through that grief process. If you are employed, you may want to talk to your employer about utilizing the Employee Assistance Program benefits. Most companies do offer that to their employees, and embedded in that benefit is counseling services that are free of charge. It's really important to remember that grief and loss is multifaceted. There really is no one size fits all. My process will be very different from yours, likely, and your process will be different from the next person. So it's really vital that we give ourselves and others permission to bereave loss. Hold no expectations for the duration of how it should look and how it should feel. I also want to share with you just the enormous amount of creativity and resiliency that's coming out from this time of adversity. This is an image that was provided by Miss Leslie Carter of Longleaf Assisted Living. And it demonstrates here just one of the many ways across this country that assisted living and skilled nursing communities are finding ways to be creative and to reimagine and reinvent what we always have known as engagement. Engagement in community. It looks differently, but it doesn't have to be vastly changed that we remain isolated. And so just leaving you on this note that there is resilience, that there is an opportunity to be creative about how we connect with our loved ones, about how you connect with your loved ones. And I want to thank you very much for joining me and all of the supporters of this webinar series. I've listed also here for you some resources. The Portland Institute for Loss and Transition has a wonderful array of trainings and also resources for you. There's some very helpful and free apps for smartphones. The COVID Coach is one app that I've used quite a bit. It's been developed and produced by the VA. Also, there's Headspace, the Daily Ohm. There's a daily gratitude journal called 5 Minutes of Gratitude. And then, of course, lots of resources available for you through NORC and through the Consumer Voice. We've listed some very helpful handouts that you can access with the link here listed below. Also some fact sheets, some information for both advocates and residents about staying connected. And then certainly other resources through NORC and Consumer Voice that involves trauma-informed care, person-centered care. And you can connect with both of them through social media, both Facebook, Twitter. So again, we want to thank you for joining us for this 4-part series. We do hope that it's been helpful, that it's been educational and a good reminder of things that maybe you've already known, but can just get you back to the basics. Thank you so much, and we all wish you well.